Well, good afternoon. And again, I'm Mike Durkin, and I have the privilege of serving as the president of the United Way here in Eastern Massachusetts. And really glad to welcome you to a conversation on what the United Way in our area has been doing in response to the whole COVID and the COVID virus relief. Every one of us, obviously our lives have been impacted, and we know that that's unfortunately probably going to continue for a while. What we're very appreciative of at United Way is the incredible generosity that's poured forth very quickly from any number of individuals and corporations and foundations. And I presume from many of you that have tuned in today, making financial contributions, sometimes doing in-kind contributions of food or clothing to any number of places. So it's been a huge response that we've seen, and my colleagues are going to tell you about that in just a minute. I'd say a couple things to you. One, I'm always mindful that this is not fundraising. This is a matter of opening a door and giving all kinds of people the opportunity to express the generosity that they have. And if United Way can do one thing, we can open that door, we can help to focus that generosity and put the resources that are donated towards the most powerful and practical ways to help individuals and families live their life as best any of us could through a very tough time. So again, our thanks for your extreme generosity. We're fortunate to be the stewards in this regard. A couple things, very soon after the shutdown and the announcement of everything that was going on with the virus, a couple of my colleagues, Lisa Rowan-Gillis and Carly Asiello and others, launched a fund. And our intentions with that were to work through a network of great partner organizations that we've known for a long time to help us get financial resources out to individuals and families that were in need. That was our basic and our sole intent at the beginning. It still is our intent. And what we've seen is it's expanded a bit, and you'll hear how, as we partnered with local municipalities and communities who also want to do good in their communities in a very focused way. So whether it's from Attleboro up to parts of the Seacoast in New Hampshire, out to the Merrimack Valley, we've seen all kinds of folks and organizations pitching in to help make a difference. That's very powerful. You're going to hear some of those stories. You'll hear how we've gone about our work. The other thing that I would point out to you is United Way is the prime sponsor of 211, which you've seen advertised sometimes on Channel 5 and other media outlets too, I presume. And then also through media and through our own website. 211 is a simple place to go to be connected directly with someone who can put you in touch with the services that are out there in your community to help solve your own problems. We feel great with the support that we've lent and what 211 lends to the community. And what we know is that service is going to continue to be important for families. So if you know somebody that needs help, needs somebody, know someone who has a challenge about knowing where to go, ask them to call 211. It's a very direct service. And of course, if they want to be continue their generosity, giving to the United Way at unitedwaymassbay.org to our COVID Relief Fund, we're glad again to be stewards of those money. So that's what's going on in our organization. On behalf of our board and our entire organization, I say to you, thanks for all you're doing, whether you do it through the United Ways Fund or any of the other ones that exist. It's going to people who have real special needs at a very important time. I'm going to turn it over now to Lisa Rowan-Gillis, our head of resource development in our organization, and Carly Asiello, our senior vice president of community impact. They've been on this since the get-go, and they'll lead us through the discussion today. Thanks again. Thanks very much to all of you. Thanks. Lisa.
Thank you, Mike. Thanks, Mike, and thanks to all of you for joining us today. To say this is an immense challenge for all of us is really an understatement. But even though it's been a really tough time for so many, there has been extraordinary generosity of spirit that we've seen at United Way. People really wanting to help other people. I'm sure many of you on the phone are some of those people, so thank you for stepping up and helping. Before I introduce Carly Asiello, let me say that you're on mute and that we welcome questions. Please put your questions in the chat box. We have folks who are ready to answer them, and there will be a question period toward the end of the half hour. And also, for the best experience, use the speaker view, and that way I think it would be helpful. So I'd like to introduce my colleague, Carly Asiello, Senior Vice President of Community Impact at the United Way, and we're going to kick off with the first question. Carly, when it became apparent that our community would be severely impacted by COVID-19, how did you and your team go about understanding and determining the best way to move forward?
Thanks, Lisa, and welcome everyone. Good afternoon. I'm excited to talk to you a little bit about this fund. When this was all starting to really play out, probably around very kind of early mid-March, the first thing we did was really we were thinking about understanding that this was not only going to be a health crisis, but it was going to be an economic crisis, and really particularly worried about our families and individuals that are most vulnerable in our communities. So what we ended up doing was immediately my staff and Impact got on the phone to the agencies that they work with on a day-to-day to just get a sense of what they were seeing and what they thought might be happening in their communities. And then we put out a survey to all of our agency partners, so ones that we fund through our annual grants, but also other ones that are involved in lots of different ways with us, to ask them specifically what did they think was going to happen to their own organization, to their clients, individuals, families, and what type of response they thought would be needed. Also kind of gaps or issues that they thought would come up down the line. So we did that immediately. We also, because we have always had a focus on vulnerable populations, we've always had an emergency assistance fund. It's about 20 organizations annually that provide funding and case management for economic crises that may hit people at any point throughout the year, whether that's not being able to feed their families, pay for heat, a loss of income. So we reached out directly to those 20 organizations to make sure that they would be ready to respond immediately to the crisis. And a couple of things that we heard right away. One, none of this is going to be surprising, but first off the bat was a real concern around access to food. Families that would be sheltering in their homes that are often disconnected from services would be even more isolated, and there was a real worry about how to get food to those folks. We also really heard immediately about layoffs and the economic impact. We know that many families are struggling anyway and aren't able to sustain a 3-month hit to their income. And so when you have something like this, that layoffs are going to have an immediate impact. We also saw that, folks were really worried about childcare. So if they were essential workers and would have to go in, what was going to happen to their kids? And where would they get basic need supplies? So anything from diapers and wipes to formula. So those were our immediate things that we really saw happening.
And tell us about our response, and specifically, what is the United Way COVID-19 Family Support Fund?
Yeah, so one of the things that we wanted to focus on, again, really building off our family fund, our emergency assistance fund, that fund is for direct assistance to individuals and families. And we wanted to use that same response here. There are other funds that are focused on general operating support to nonprofits or focusing on small businesses. And when we looked at what our strength was, it was really around making sure that individuals and families had the funds needed for those basic things. So we are working with nonprofits who then give out our funds directly to those individuals and families, whether that's the form of a gift card, a grocery card, it might be paying for rent, those types of things. And we already had the response system built in because that is how our family fund operates. They know how to do intake with families. They have people that they can reach out to right away to see what kind of supports they need. And the other thing that I find to be really important is that it's not just about giving a family or an individual money, which is very important, but it's also about what we would call case management. So what other things might come up for that family? Are they needing to be connected to another service that they've never had to think about or use before, and how are they going to do that? And also really focus in on their own anxiety and worry for their entire family, and making sure that there's a way to have ongoing communication. So we thought that was really going to be the best way to help those individuals and families.
And what can a family do? How do people get help, Carly?
So, you know, as Mike mentioned at the beginning, one of the things that we've really been telling the general public is it's very important to call 211. 211 is Massachusetts' first call for help. They are the designated COVID response call line, and they're going to know for everyone in their own home communities what are the nonprofits that are up and running, able to respond, and also able to meet the specific need that the person's bringing up. So we have distributed funds to over 70 nonprofits at this point, but we also know that that money, once we give it out, it's out the door as soon as they have it. So we don't want people to be frustrated and calling and this nonprofit and that nonprofit and not finding the right match. So 211 has, you know, actual people that are trained, they're specialists and are able to really take in that information and then connect them to the right service.
And what are you anticipating next? What are you thinking what will happen next, and what are the sort of trends we're looking at?
So a couple of things, I'll talk a little bit about, you know, I was thinking about out of, you know, when I said we funded 70 organizations, kind of where do they fall and what are they focused on? You know, as I said, when, you know, the first thing that we heard was food distribution. So we've gone about that in a number of different ways. We've first immediately reached out to food banks, food pantries. So I can give you a couple examples. Weymouth Food Pantry, Chelsea, we've been hearing a lot about Chelsea, and I can talk about that a little bit later, but we've heard a lot about Chelsea in the news. So we made a specific grant to the Chelsea Hunger Network, which is a coalition of pantries together. Merrimack Valley Food Bank, the Open Door, Catholic Charities they have food pantries across the region. So obviously the Greater Boston Food Bank is a great resource, but we wanted to get to smaller organizations that are providing localized supports. And then most recently, one of the things that we heard through the survey is that Boys and Girls Clubs and Ys have really stepped up to do food response. So reaching out to their families and becoming, you know, emergency locations to get food. So we did a whole distribution just for those types of organizations, which I think most people don't think about when you think about food distribution, but have been really critical resources. So that's one thing that we focused on. Another area that we were very concerned about was domestic violence organizations. Again, you might have heard on the news, when people are sheltering in place, sometimes home isn't the safest place for everybody. And so what are those people doing and where are they going? And then how can we support those organizations? So we also reached out to a number of our different domestic violence organizations, Hawk, which is on the North Shore, Elizabeth Stonehouse, which is actually right near me and JP, a number of other ones, and really asked them what they would be needing for their families. And you know, a lot of, you know, in every case when people are fleeing an abusive situation, they come with very little. So they need to have, you know, the ability to get direct supplies. A lot of times it's infant, baby supplies, and then things for the people that are escaping those situations. I'll go to one more and then you see if you have other questions. But another one that I wanted to focus on, and I know I saw Larry Siemens is one of the folks that signed in. He's the head of Family Aid, and family homelessness, chronic homelessness were things that we were incredibly concerned about. So we reached out to those organizations and made initial, that was in our first line of distributions, was to homelessness organizations. So in addition, victory programs, Mass Coalition for the Homeless. One of the things we were actually able to do kind of on the side of this direct assistance, we got a call from a big organization that was able to make a donation of, I think it was 380 twin mattresses. But they said, we have the mattresses, but we don't have the funding to actually get them to organizations. We reached out to victory programs and Mass Coalition of the Homeless. We're able to cover the cost of all the shipping, and now they are getting those mattresses out. Mass Coalition of the Homeless just sent us pictures. They're having families come by and do contactless pickup of mattresses for their kids because it's not necessarily something that everybody has. And when everyone's all together in a home all the time, you know, to be as comfortable as possible is really important.
Thanks, Carly. I'm wondering, before we go to questions, there's just one last thing I think might be of interest. We have created some really interesting partnerships with cities, and it's just pretty innovative, I think, and might be of interest to our listeners.
Absolutely. So one of the things that we heard actually right away, one of my colleagues who's one of the, has been spearheading a lot of this work, Gail Sokoloff, lives in Newton, and her family was really involved in a lot of the mutual aid work going on in Newton, and had asked if it would be possible for United Way to step in and help them create a fund to raise money for residents of their own community. And we, without hesitation, said, yes, of course, that seems like, a real kind of sweet spot for us. We're able to get those pages up, but also not only to just create a portal to take in funds, but we can also serve as experts as a community to help them figure out where are the funds going to go, who's going to qualify, how are they going to get the word out. So we become their marketing arm. We help them with fundraising. We become their impact expert as well. So we thought, okay, that's wonderful. We'll do it in Newton. All of a sudden, we started hearing from others, cities and towns. So right now, beyond Newton, we have funds for Lynn, Everett, Chelsea, Somerville, Winchester. We have another 5 that are up and running. I would definitely put a plug in for anyone that's interested. You can go to our website and learn about them. Each of the towns, what I find to be most fascinating is each of them come with very different needs. So, you take a place like Lynn, where there's lots of nonprofits, lots of different organizations that can help. So they're rich on that. Other towns, Everett, say for instance, doesn't have a lot of nonprofits. So we're there to say, okay, what are the needs? What nonprofit can we bring in to help? So it's really kind of varied from city to city. And I think it's a way for residents to give back to their own neighbors. And that, I think, is something that's just such a value of United Way.
So I'm going to open it up to questions right now. Anyone would like to type a question into the chat box or ask Carly a specific question? Now would be a time. If not, we have other, we can definitely keep going, but I want you to have the opportunity to please ask a question. Carly, what are we doing around public policy? What kinds of issues are we seeing, and where is United Way leaning into that?
So public policy, obviously there's lots going on right now at the state and federal level. There are a number of our own staff, and then also we just, thankfully, right at the beginning of this crisis, hired a new public policy director, Danielle Kim, who I think is actually listening in. She and a number of other staff have been connecting to different policy conversations. Everything's happening kind of day to day, weekly. So we are on public policy calls around early education, around food access, around homelessness. And the response is varying in terms of, for early ed, it's been, let's talk to the Department of Early Education and Care to make sure that those childcare and family childcare organizations are able to sustain this whole thing. And either they're providing childcare right now in an emergency, or they're closed. And we want to make sure that they're going to be open, when this is all over. So what can we do around that? Around food access, it's been what are the ways that we can kind of change regulations so that other organizations can become pantries? How do we get food to different places in the community? So a lot of problem solving on the ground. Been really, really interesting. I think the public policy efforts are going to go on for a very long time.
So a couple of questions have come in, Carly, from Robbie Bidding. I'd love to better understand a very basic breakdown of where donations to COVID-19 fund go. I understand there are many programs and initiatives in the works. Can you break down some of the rough percentages? Also, perhaps along that line, additionally, how are we coordinating with the other funds?
Oh, okay. So I can give you a couple different ways to think about where the donations are going. So one is geographic. Right now, we have supported 12 organizations in the North Shore, another 12 in Merrimack Valley, about 5 or 6 in the South Shore, 13 actually in the Seacoast. I don't know if everyone here is calling in from Massachusetts, but we actually also have work happening in the Seacoast region in New Hampshire. And then 6 nonprofits in the greater Attleboro-Taunton region, and then rounding out with 42 in greater Boston. So that's over 70 organizations. Beyond that, in terms of the actual organizations that we're providing, I would say, trying to think of in percentages, probably at least, I don't know, probably half of them, I mean, more than half, probably 70% would be qualified as like actual just basic needs organizations. So things like homelessness, food pantries, that type of work. Probably about another 10, 15% are in the early ed, out of school time kind of area. And then the rest would be what I would call multi-service organizations. I'd say the other area, and I can't give you an exact percentage, I have to count it out, but one of the other areas that we're very interested in focusing on are immigrant organizations. So making sure that different populations are receiving culturally responsive and appropriate services. So we've been really focused in on different regions, who might live in those communities, and then what are the best agencies to serve them. And I can give an anecdote on that for Chelsea. And Chelsea, you know, a large number of the population are, they're Spanish speaking or Haitian Creole. So we are working directly with organizations that are known to grassroots organizations that are working with those populations specifically, so it can be in-home languages and responsive to what the needs are there.
That's great, thank you.
You're on mute.
Know how much we've raised so far in the fund, and what is particularly happening? What are we doing for laid off workers and immigrants?
Okay, so we've raised, I think, and Lisa, you can correct me if I'm wrong, you might know this one. I think we're coming up on $5 million raised. You didn't ask this, the person didn't ask this, but I know some people have asked, like, do we have a goal? And I think, as Mike said before, this isn't a fundraising campaign. We are, you know, trying to meet as much need as we can. So we don't have a goal, but, you know, about 5 million has gone out. So we've gotten so far. We are doing distributions weekly. So as soon as this all, you know, unfolded at the beginning, we seeded the fund with our own dollars. We pulled funding from our family fund, and I actually went through our entire budget to look at any dollars that we could get out into the community right away. So we were able to make a distribution within 4 days of us standing up the fund. And then since then, every week we are doing a distribution, and always being mindful of geography and issue areas and what are the new needs that are emerging. In terms of laid off workers and immigrants, I can give you one actually very specific example. We work with an organization called BEST, HTC, which is typically a job training and placement organization for the hospitality industry. Obviously, you can imagine that they are incredibly hard hit. Right at the beginning, they called their 10,000 clients that they work with within the hospitality workforce and asked them specifically what they needed. And we were able to get them funding so they can actually get out checks for lost income. So that was the approach that they were taking. And we're doing that with other, our other job training and placement organizations as well.
Carly, can you address, Chelsea has been really hard hit, and I know you and your team have been very concerned and working collaboratively with the Chelsea folks. Can you speak a little bit more to that?
Yeah, and so in Chelsea, what we ended up doing, when we saw the crisis really unfolding there, we reached out to their town manager and asked them to pull together some folks on a call. So initially, we just wanted to hear what they were seeing as challenges. And really quickly, we realized that we wanted to put up a fund specifically for Chelsea so that donors either within Chelsea or outside that are hearing about it would be able to provide funding directly to those residents. We then asked the city to reach out. We had organizations that we were already funding in Chelsea. We wanted to know what were the ones that were really on the ground there. So they brought forward Chelsea Collaborative, Green Roots, and then the neighborhood developers, which we had already been working with. Those were the three initial organizations that they wanted us to work with. Those organizations are all really in touch with the community. Folks saw there was some piece on the news about them. One of the organizations is actually going out door to door and giving residents checks in the amount of $250 right now, which doesn't seem like a lot, but if you're worried about where you're gonna get food, and if a gift card to Stop and Shop is gonna be you can't actually get to a Stop and Shop, you need that money so that you can go to your local food grocery store to get that. So we're still we talk with them probably every 2 or 3 days to see what else they might need. Mike Durkin actually was on a number of calls about working with them on some homelessness issues, some food access issues. So we're trying to be as flexible as possible and help them in any way we can. There is a specific fund. I think it's already raised a little over, maybe it's up to maybe $175,000 at this point. More is definitely going to be needed for that community.
Thanks, Carly. I see we're just about up against our time. We will keep the chat room open. I see there are lots of good questions about volunteering, about how much money we've gotten out. We will answer all those, and we will keep the chat room open for a while. I'd love to hear back from you as to whether or not this was helpful. If you have ideas for other topics for us to cover, we'd like to stay in touch with all of you. Also, special shout out and thank you to some of our largest funders, Bank of America, Klarman Family Foundation, Eastern Bank, Cummings Foundation, Wells Fargo, Dell, Biogen, Blue Cross Blue Shield, Eversource, and all of you who have participated and been so generous with your funds. So thank you. Stay tuned. We're going to keep the chat room open for a while. Thank you, Carly. Thank you, Mike.
Absolutely. I'm going to put into the chat our website and right to our COVID page, because it has a lot of information on here about how you can not only give, but also consider. I know there was a question about volunteering. So there's some examples of things that you can do. Lots of good resources there.
Thank you.